Hi guys. I'm sorry I couldn't send you a recording last week. I was struggling with my screencast, but I can this week. So yes, um, this is your final unit. So I want to say congratulations. We're almost at the end of the course. So well done for sticking at it. So your unit 6 is on the structure and organisation of the healthcare sector. So just to reiterate, there isn't necessarily an assignment for this. There will be a workbook to complete at the end, which helps us, which serves as some sort of formative assessment to help us in estimating your grade for this. There is no end date for this workbook. I will put it in an email this week so you can start working on it from today. And you can hand it in at some point at the end of June or July. Okay? Right, so the learning outcome for today is just to wrap our heads around how the healthcare sector is currently organised and funded. So we're just going to skip past that because there is no assignment for this unit. Okay, so a quick kind of history around the NHS. Do you remember your unit 1? Okay, you remember why we had the NHS in the first place, the social structures that had to change, the reforms that happened, and we have the two wars, the two big wars that led us to realise, hey, as a nation, we do better with, when the government steps in, we do better with a publicly funded healthcare system, and we have the NHS today. Fast forward, we had several reforms. So we had the internal market that kind of changed the NHS, or made the NHS start to function like a market. And in 1997, we had Tony Blair's administration kind of restructure again the NHS. However, in 2012, David Cameron's administration again restructured in a kind of massive way the how the NHS functions, and you should have watched the videos from last week, okay, showing you how the NHS works. This really complex looking diagram is basically how the NHS structure looks like today, and it kind of shows us the different parts of the NHS, how the kind of what's the word? We have the two main so here we have the structure of the NHS. This is what it looks like roughly today. I'm pretty sure it's changed since the last time they made this structure or this image. So we have the hierarchy of things. We have our two main players, which is NHS England and Public Health England, and we will explain it better in this diagram. So this is what the 1997 restructure looked like, and this is what we have today. So let's call the Department of Health the Queen, okay? And then we have under the Department of Health, we have NHS England and Public Health England, who are the two main players. Let's call Public Health England preventative side of medicine, and NHS England the clinical side of medicine. We can call NHS England and Public Health England kind of the prime ministers. Okay, the prime ministers obviously answer to the Queen. So in terms of authority, Public Health England and NHS England answer to the Department of Health. Under NHS England, the clinical side of medicine, we have our 211 as at 2013. I believe as of 2020 we have 191 clinical commissioning groups. They are responsible for where the money flows, based on evidence of good practice, based on evidence of needs of NHS trusts, which are hospitals, mental health units, community services, etc. Here we have our GPs, dentists and specialist service. They get their funding directly from NHS England and not the clinical commissioning groups. Okay, these are primary care and they provide primary care to the patients. Okay, so Department of Health provides leadership and funding to NHS England. NHS England provides funding to clinical commissioning groups who provide funding to hospitals, mental health care centres, community services. Now, GPs, dentists and specialist service tend to be private, if you like. So they're not necessarily part of our hospitals, but they have contracts with NHS England, so they get their fundings from NHS England. They are all primary services, primary care services, and that provide primary care to you and I through the taxation, through our paying tax that goes to Department of Health. Okay, clinical side of medicine. Then we have preventative side of medicine. Public Health England, obviously, provide funding to public health services in local authorities who provide public health care to the general public, again through the taxation. Okay, I hope that makes sense. Again, please watch these videos. I think they have done such an in-depth explanation and they're probably a better job than I have. Okay, so let's look at each player, if you like, of the NHS. So the Department of Health is responsible for the strategic leadership and funding for health and social care in England. The Department of Health is a ministerial department and it is supported by 23 agencies and public bodies. Okay, so in the hierarchy of things, they are at the top of the NHS. And then we have NHS England, formerly the NHS Commissioning Board. And the main purpose of NHS England is improving the health outcomes of people in England. And they do this by overseeing the work done by the CCGs. They hold them account and they allocate resources for the commissioning of services such as we mentioned in the previous slides, primary care and highly specialised services. Okay, they are accountable to the Department of Health. Public Health England. Okay, in your own words, what is public health? Okay, so I want you to write this in the comment section. What do you think public health is?